Hello, everybody. So I'm Deborah Lockwood from Life Changer, and it is my absolute pleasure to invite today Dr. Anne Curtis. She is the SUNY Distinguished Professor in the Department of Medicine at the University of Buffalo. She is also past president of the Heart Rhythm Society and a recipient of their Distinguished Service Award and their President's Award. She's also past president of the Cardiac Electrophysiology Society and the Association of University Cardiologists, and is a past chair of the Department of Medicine at the University of Buffalo. So welcome, Dr. Anne Curtis. And please, I would like to start by asking you what you think makes a good mentor, how to find a good mentor, and how to be a good mentor.
Well, very important question. I think to be a good mentor, you have to think about more than yourself. And one of the things that makes it easiest is when you're established in a career, when you really are in a good trajectory or you've achieved a lot of what you want, there comes a time when I think many people think about giving back. And one of the ways you can give back is by mentoring younger people. So, and it can be a very rewarding thing to do too. So I think it's, first of all, having the interest in doing it, having the experience that makes it worthwhile for somebody else to listen to what you have to offer. And, being open to people when they approach you about needing guidance or wanting to have mentorship. So I think those are the key things. If you're looking for a mentor, then I think you're looking for those kinds of qualities. Someone who's open to giving you some time, who will give you advice. And then ideally, it can be a two-way street, whereby if you provide the advice to a mentee and they can take it on, sometimes they can also work with you on projects, and it's mutually beneficial. It helps the mentor get some work done that might be too much for one person to handle, and it can be a big boon to the mentee in terms of getting opportunities to do things like co-author editorials that often it's a much later stage of your career before you get a chance to do something like that.
Mm-hmm. And where would you suggest that people find a mentor? Should they look for them in their own university where they'll be able to come face to face often, or is it better to look for somebody who has the same interests in you that you might meet, say, at a meeting?
I think it depends on what you're looking for at the time. Having a mentor nearby is the easiest in terms of, as you said, you've got the face-to-face connection. When I first started my career, I was the only electrophysiologist at the University of Florida, which is where I started. And the only mentor I could get locally was somebody who was not an electrophysiologist. So there was some value to that. I worked with that person to help me improve grants that I was writing. So that worked even though we weren't exactly in the same field of study. But beyond that, having mentors outside the institution is also helpful, especially if you're trying to get into leadership in your professional society or get into clinical research that's more directly related to a field like electrophysiology. You really need mentors in your own field. Today, most institutions are going to have multiple people. EP sections can be quite large. And so it should be easier to get mentors locally in that. It wasn't for me at the time, but now it should be. But if you're not seeing what you need there, then looking outside is a perfectly acceptable thing to do. That's what networking is all about, is learning about other people.
Mm-hmm. So there's a number of institutions that are trying to begin projects where they match mentors and mentees. So what do you think should be used in order to match them? Because, it's not always, sorry, it's not always enough just to say, well, she's a female, she wants to do cardiology, and here's a female cardiologist. And that seems to be one of the criteria that they use as the main thing here. So what's your experience in that?
Well, I think there is some value to that. When I was head of electrophysiology, I got a fair number of women who decided to go into EP, and I'm sure it was because I was a woman. They felt more comfortable that it was an attainable idea. If I was, had children, was raising them, and had a family life, then they could do the same thing. So I think that does help. Uh, it can be tough if you're a woman and you're always getting called on in that regard. But the issue is, especially for early career, if you're at the late stages of training or early in a career, that's often the prime childbearing and child rearing years. And I do think women have some unique experiences with that that can be helpful to somebody younger coming up that not every man is going to know about. So I wouldn't shy away from the idea that having a mentor be a woman, isn't something that you should go after. I think it's fine. But if you can't, then there are plenty of male role models who would be open to trying to mentor as well and give very good advice.
Lovely. Thank you very much for that. Okay, so I know that you've been the president of the Heart Rhythm Society, for example, and another number of other positions of that sort. If you're an early stage career cardiologist and you are interested in doing that sort of thing, what's the best way to get started?
Ask. That's number one. Raise your hand and say, yes, I want to do it. Right now, they do have in the Heart Rhythm Society, there are ways that you can volunteer. And so on at least an annual basis, there's a way of sort of electronically raising your hand and saying that you want to get involved in things. For women in particular, there's another good option, which is that there's an email distribution list that's managed that has, oh gosh, must have 150 women on it. And periodically, when there's a new guideline that's going to be written or other kinds of opportunities like that, then one of the women on the group will mention it and specifically say that if somebody's interested, go ahead and apply for it. So sometimes knowledge of those opportunities can come up pretty organically, that you can see them and then apply for them. But if that doesn't work, then I think you got to, maybe literally or figuratively raise your hand and say, I really do want to do something. I always tell people the first time I got involved in the Heart Rhythm Society, and again, I had nobody in electrophysiology where I was. It came about because I happened to be on the same program as the person who was the current president of the Heart Rhythm Society. And so he didn't know me, but I went up to him at the conference and said, I really would like to get involved in HRS. And he put me on the training program directors committee. Now, that is not, it's an important committee. Is it one of the highest level committees within the Heart Rhythm Society? No, but that's not where you want to start anyway. You want to start someplace where you can get to know people, where you can show that you have value. Because for any of these opportunities, anytime you get them, the most important advice I would give anybody is capitalize on it. Make sure you do a good job. Because if you get on a committee, you miss half the meetings. When you attend a meeting, you never speak up. Okay, you may get that one opportunity and never get another one. If you provide value, if you volunteer for extra assignments when something has to be done, and you come through and you do them well, people will notice. And so that is not, that's a good way to get further opportunities. The other place where I had something like that happen was one of the first clinical trials I ever got involved in. Now, how did I do it as a young person? Again, it was networking. The person who was the principal investigator was the head of cardiology where I did my internal medicine training, and he knew me very well. I asked to be part of the clinical trial because he knew me. He let me be the site investigator at Florida, so I got that. And then he put me as a co-chair of one of the committees for the trial. I got to know other people that way, and then one thing leads to another. So it's the networking, it's speaking up for yourself, and then it's capitalizing on the opportunities that you have.
Wonderful. So you actually bring us into the next thing, which is not so much how to get involved in things like the Heart Rhythm Society, but how to get involved in research, and in particular, how to work your way up so that you can be a PI and so that you can maybe have industry sponsorship of what you want to do,
Right.
or even what they want to do, just industry sponsorship that you're the PI for. So can we talk about that?
Yeah, when you get started in research, for some of the highest profile clinical trials, if you don't have a track record, the odds of you being a site investigator are probably not very good initially, but you want to work towards that. So how do you get there? Well, one way to do it is to have an opportunity to enroll in sort of a minor clinical trial just to show you can do it. Example, sort of a typical example to me within the field of electrophysiology is when there's a new lead or something like that that has to be tested. And the company has to have X number implanted across the country, followed up to be sure they work well and all that. Is it going to revolutionize the practice of electrophysiology? No, but they have to do it. And if you can say, I can enroll patients in it, you do a good job, okay, you've been part of a clinical study that goes on your curriculum vitae. And then after that, maybe you get the next trial that maybe is a little bit more important than that one. You have to show that you can do it before you get some of the premier opportunities. So, whatever clinical trial you can get your hands on, sometimes you'll be in an institution where you are enrolling in a major clinical trial, and maybe you're not the site investigator because, again, you don't have that stature yet, but you are one of the electrophysiologists there. Well, if you can be an enthusiastic enroller in it, that can be helpful. I would make sure people know it. Because if you just sort of quietly enroll, the site PA's, the site principal investigator is most likely to get the credit for it. So, if you are going to do that, you want to make sure that people recognize that you've done a good job with that. From there, if you've been doing a good job, then I always think that the people who are the heads of electrophysiology are the ones that are really known at a particular institution. They get a lot of those opportunities. As they get more senior, they should be at some point, this is where mentorship comes in again, they should be willing to share some of that with more junior people and let them have the opportunities to do some of these other trials. You can't be the principal investigator of everything, or you shouldn't want to. Because you really should be helping to develop other people. So, and I think being gracious like that and allowing other people to get involved in it, I think it is a good thing. So you can get involved in clinical trials that way. Another thing that you can do just to increase your stature in clinical research is your own investigator-initiated studies. So when I was first starting out, for example, I wasn't going to have 300 patients to enroll in anything. I didn't have that many. But I was able to find some studies to do that really required a very small number of patients. I've had some good papers published that involved 20 patients, 17 patients was a good JACC paper I had. And it was all about making an observation that was unique, that was important, and getting it published. And people noticed that as well. So investigator-initiated studies where they're your own and you get the full credit for it in publishing that. One of the downsides to the big multi-center clinical trials is the fact that it's a multi-center clinical trial. So if you've got 50 sites across the country and you enroll 13 patients, how much credit academically do you wind up getting for that or getting noticed? That can be a little bit difficult. So I think some of the investigator-initiated trials allow you to have another way of getting your name known out there. But then within the clinical trials themselves, again, enrolling well and doing a good job, making sure that the coordinators do what they're supposed to do. And if you do a good job there, then over time you can get noticed for some of the bigger opportunities. Sometimes one of the things that can come up is secondary papers. So I've had a number of those, and I think that's something not to forget. So maybe you've been enrolling in a clinical trial, and again, you're one of 50 sites. There was a lot of people enrolled, several thousand patients. The main paper gets published in the New England Journal or wherever it goes. Well, a lot of times there are secondary observations that can be made out of trials. Now, the major ones will often be managed by the executive committee or the steering committee, the highest levels there. But it's also very possible that you can have an idea of other things to look at within that clinical trial. And there are ways that there'll be publication committees with major clinical trials. And a lot of times what you can do is they'll have a one-page form or something where you can say, geez, this is an idea I have. I want to look at this aspect of the trial. You know, these are the data I need. This is how I want to do it. And for the people who run the clinical trials, the more papers that get published out of that trial, the better they look, you know, so they're happy to have that. So if you have a unique observation or a unique idea, you know, there's a committee that'll approve which ones that they want to move ahead for. Because a lot of times you need some support for that, say statistical support. And then you can go ahead and get noticed for those kinds of secondary papers. And because they're parts of major clinical trials, it's pretty easy to get noticed from that too.
Great. Okay, so one other thing that you said that is important because there are people thinking of going into cardiology, women in particular, thinking of going into cardiology, who are literally being told you can't be a success in cardiology and have a family. And in front of me here, I have someone who has been a major success in cardiology, both academically, clinically, and in organizations as well. And you have a family. So how how did you manage to do that? And also, did you learn from that things that you would advise to these younger people? Firstly, obviously, it's possible. Um, but secondly, is there a better time in your career where you can have children or just when it happens?
Oh gosh, you try to plan these things and it doesn't work out very well, right? So, you know, these things happen when they happen. I mean, I had my first child when I was still a cardiology fellow, so, and then the other two when I was a junior attending. So, you know, I don't, you know, you'd like to think that you can plan life very well, but it often doesn't work out that way. I mean, the things you have to do are you have to have help. Many women, if we're well paid in cardiology, you can afford in-house help in your home. And I would strongly encourage that for anybody. I think getting the kinds of help you need, a supportive mate, spouse, can be enormously helpful as well. They have to understand that it shouldn't all fall on you. One of the things that worked for me was having family nearby. So, I had both sets of parents, and at the time my children were young, I lived in Gainesville, Florida, which is a college town. So it was easy to get around. If for Mother's Day they were doing cupcakes at the school, and I knew it in advance, I could arrange my schedule. It took me 10 minutes to get over to where the school was. I could hang around there for half an hour and then go back to work. It worked out for me. There are ways that you can do that kind of stuff. The other thing too is you just have to give up the idea that you're going to be at everything that your children do. You know, if it would truly bother you not to be at every soccer practice, then, possibly being a cardiologist is not the right idea for you. I always felt that I didn't particularly care if I was at the practices, but I wanted to be at the games. And so I made sure that I could do that. So I think you have to pick and choose a little bit. I do like to tell people, you're not going to be able to do an A-plus job at everything all the time. And so, there are times when there's something going on with your children and they do have to come first. There are times when you have patients at work and there are things going on and they have to come first. And so you have to have your priorities straight and then prioritize whatever needs to be done at the time. And you know what? Everybody will do just fine. So at the end of the day, just feel confident in that. I have two daughters and a son. Everybody's grown now. My oldest daughter is a physician in her own right. She's a pediatric physiatrist in Kansas City, and she's doing very well. I have another daughter who works for a nonprofit in New Jersey, and a son who works in IT. They're all doing very well, and they all survive. So and I think it's important if they see that their mother is happy and successful at what they do, it gives children the feeling that they can do the same thing. And so I think it helps instill confidence in your offspring that the world's open to whatever it is they want to accomplish.
Yeah, excellent point. Yes, I love that. I think we can probably finish there, except to ask you if you had the opportunity to talk to yourself as an early career cardiologist. If you had just like a minute to talk to them, what would you advise them? Especially if you have to transpose them, I think, to coming into cardiology now because things have changed somewhat.
I think things have changed a lot. I think that's tougher. I mean, if I were to go back and say, knowing what I know now, what would I do differently back then? I think probably very little. I knew electrophysiology was going to be a very busy field, but I love the field. Sometimes I'm almost a little surprised that I figured out how to navigate a lot of these things. We now do a lot of these kinds of programs to teach people because I really didn't have a mentor to tell me how to do it, but figured it out. So I'm very satisfied with that. I think what makes it harder now, it's probably one of the things to watch out for too. If your goal is patient care 99% of the time, and that's what makes you happy, go for it. You will be busy. You will be compensated very well. If your goal is to do things more than that, if you're trying to get to, involved in clinical research, involved in the professional societies, then you have to find ways to make time for that and negotiate that. And if you cut back on the clinical work some, there can be some impact on income as well. But yet, if it winds up with a balance that you feel happy with and satisfied, and you fit in well with the organization you're in, that can be a very good outcome.
Yeah, very satisfying. The most important thing really is to love what you do.
Absolutely. Sure. Yeah.
All right. Thank you very much. Thank you so much for your time and for your insights.
You're welcome.